Hey everyone, so in today's video, what I want to discuss are two loading strategies that we have covered in our new knee program, with a little bit more insight, deeper insight into the kinetics underpinning these strategies, the kinematics underpinning these strategies, and of course, why you might use them, when you might use them, how much you progress, how you might regress in these situations as well. So of course, what you see straight away on the screen here is that this strategy above is week 3, number 7, while the one below is week 1, number 2. And you might look at the one below here and say, that looks like a much more challenging loading strategy for the lower limb, while this one here, it's a shorter lever, and so it may not be as challenging on the lower limb. And that's true. It's a more challenging strategy. This one here below, week 1, number 2, is. And of course, we would start this with a double leg strategy. We wouldn't jump straight into a single leg strategy. So of course, we have to understand that that is going to be a much more challenging strategy for the lower limb. But then the question is, if we're dealing with knee issues, is it more of a challenging strategy for the knee? Meaning when you apply load to the system in this position, which represents the kinematics, how you're setting up the trunk, how you're setting up the femur, the pelvis, the shin, the foot segment. Is it more challenging on the knee? Meaning, is the limiting factor or the thing that is going to stop you being able to continue the exercise? Is it going to be the knee? Is it going to be the muscles that connect directly in around the knee? Is the knee going to be experiencing all the load? Even if it's less total load, there is a big difference between how much total load the whole lower limb is experiencing and whether or not you're actually experiencing a concentrated load into a local tissue. Because of course we know that when you can have a higher load on the lower limb, but proximal tissues, distal tissues may be experiencing most of that stress and still offloading the tissue, the area that we actually want to deliver stress into. Now, there are nuances here as well. So in this strategy above here, we have discussed some of these features in previous videos. But when we have the knee at a right angle, and we have the femur particularly in a position where it's perpendicular to the ground, and then we have the tibia, the shank, parallel to the ground, when we're driving through the heel, we're typically driving straight down. Sometimes you may want to add, we'll talk about the direction of force here as well. You can drive straight down. You can also drive down and back. But when you drive straight down, the external force vector, meaning the direction of that force, how it moves through the system, will be parallel to the femur. Okay, meaning there's not going to really be much demand on the femoral, the hip extension component via the femur. Okay, so for example, the external force isn't going to be trying to push flexion into the hip in this position here. Now, you will be getting more of a kind of a pelvic bias strategy here, but that will be influenced by how much you choose to lift the hips from the ground. And that's why generally when you're trying to get load into the hamstrings, you don't want to lift the hips up very high from the ground. So you'll see here as I run the video here, it's just a short clip here. I'm not really, that's kind of where the lift ends. So I'm really only going up 2 inches, maybe 3 inches. That allows me to keep that demand on the knee flexion component. Okay, and because obviously that external force vector that moves into the system as a result of the interaction between the heel and the block here will be running perpendicular to the shank. Meaning, if you imagine force vector trying to move in this direction, it's trying to put extension into the knee. And when the external force vector tries to put extension into the knee, the flexors of the knee need to generate an internal moment, an internal knee flexion moment. And that's going to be primarily expressed via the hamstrings. You're going to get some calves here as well, but mainly through the hamstrings. But because of the kinematics here, because of the organization of the femur, the tibia, the pelvis, the trunk, most of the demand is going to be concentrated into the knee. Okay. Now, why is that important? And why is this week number 3, not week number 1? Well, the reason is because many clients, and I can't tell you how many clients I put in this position and they feel a pressure building in the knee not necessarily an experience of force and load into the hamstrings. Now, there is no nuance here, like I said. Generally, I will see this in clients that have more tibiofemoral sensitivity, meaning when you palpate around the knee joint, they may be sensitive around the joint line, or when they point to pressure where they feel the pain, they may point to the inside or outside of the knee. That's where I tend to see people have limitations with this the most. If it's more patellofemoral irritation, if people point around the kneecap, for example, above and below the kneecap, they may not have as much difficulty in this strategy. So this is where you can't really add that much nuance into a program, but if that was the case, then we may use this earlier on. But in general, it can be helpful to try and drive load into the muscular tissues early on without constraining load into the knee itself. Okay, because again, gives you, as long as you have intention behind it, as long as you're not trying to do something just because it's hard. If you understand why it's hard, you understand the limitations of it relative to what your endpoint goal is, then you know what you're progressing towards. Okay, so if we look at this compared to this one below, of course, the biggest difference is the fact that we have a foot that is pretty much at the same level as the hip, okay? And whenever that's the case, in general, you're going to get much less knee flexion demand, okay? Now, you could say that if I was to move my body very far back away from the foam roller, meaning that shin would be approaching towards a parallel position, you are going to get more of a knee flexion component, but now you're going to get a significantly bigger hip extension moment, meaning there's going to be a much stronger challenge on the hip extensors. Whereas when the heel is above, or the foot's above the level of the hip, we can constrain that demand into the knee, okay, as the shin is more parallel to the ground. But in this position here, and I have that foam roller propped up in a block here, primarily to give me the opportunity to drop the heel. I don't want the heel high here, because what I'm trying to do here now is I'm trying to, like, one of the intentions here, for example, would be to try and get some load into the hamstrings, into the glutes, into the calves, without constraining a lot of demand onto the knee itself, okay? As a nice entry point, as a nice way to just expose some load to that whole limb, but still getting some load into the hamstrings. What allows us to do that is the fact that we have the heel dropped, meaning we have the knee, the ankle in more of a neutral position. So when I drive load into the foam roller, I'm not driving load straight down. I'm driving load down and forward in this direction. So the force vector would be moving in this direction here, and now it's going parallel to the shin. Okay, meaning there's going to be much less of an internal knee flexion demand. There is still going to be some here, of course, but there's going to be a little bit more demand on the hip extension component of the hamstrings. We're going to get more load to the glutes. We're going to get a little bit more demand into the calves here. Like I said, of course, we're going to get some load into the lower hamstrings as well. It doesn't mean you're not going to feel burning there, but again, it's not constraining that demand into the lower portion of the hamstrings. It's not constraining demand into the knee flexion component. And of course, like I said, you would start here with a double leg strategy just to build that tolerance. And I in general have clients press their hands into the ground here to assist the lifting of the pelvis at the beginning, just to get them comfortable with it. And then we can gradually remove the hands from the ground, because clients will cheat by doing that anyway. You'll see clients digging their elbows into the ground. You'll see them pressing their hands into the ground. It is a cheat because, again, it allows them to use the shoulder extensors to help lift the pelvis and the lower trunk off the ground. But what's really important there, like I said, is the direction of force that moves through the system and understanding why you might use this strategy. Now, you may use it as a way to just get some load into the glutes. You may use it as a strategy to try and kind of get that connection between the hip and the foot, or the glutes and the plantar flexors. You may choose it as a way, as not a knee exercise, but you may choose it as an early loading strategy for the ankle plantar flexors. Meaning, let's say that, for example, the client could not tolerate load in a standing position for a long period of time. They've been avoiding load through the lower limb. This may be a nice, helpful early loading strategy just to build some confidence and exposure of load across the lower limb while getting some small levels of load into the foot and the ankle. We can challenge that even further by maintaining the position of the hip as we dynamically move the ankle up and down while keeping the position of the hip. You can make that even harder by coordinating hip extension with ankle plantar flexion as well, because then you'll be plantar flexing more of the mass of the body. So for example, if you were to keep that pelvis stable there in that position and you drop and lift the heel, you're essentially going to be moving the femur, okay, and moving the tibia, moving the foot, the mass of the foot. You'll still be trying to maintain the position of the pelvis, but if you were to drop the position of the hips and drop the heel, and then as you plantar flex, you lift the hip at the same time, generally you'll feel a much stronger demand because you'll be plantar flexing more of the mass of the body simultaneously. Again, generally I find that clients will note that they feel a lot more demand on the calves there. And what you could say there is that it might not even be the mass of the pelvis that is creating the challenge, but it's the coordinated demand. And anytime you have more coordinated demand, you're going to get more cortical engagement. There's going to be much more stimulation of neural circuitry, and you're going to get, as a result, more neural drive into the tissues. And because there's an element of coordination there, it's going to be the nervous system is going to be a little bit more challenged to kind of send the appropriate motor signals to the tissues, and so you may feel a little bit more of a sensation of loading there, okay, because of the neural drive, not secondary to the actual force output through the calf, for example, okay, and that's why I think sometimes people can feel like the cramping, the burning sensation build up of muscles, even when there's not real significant external load demand on muscular tissues. But again, that can be very helpful during the early phases of rehab to get that cortical engagement, to bring that attention to the area. Even getting more cortical engagement has been shown to have, influences on those descending pathways, those pain inhibitory pathways, those top-down pathways that can have an influence over perception of pain. And that's why a component of my thought process is that's one reason why clients may feel a reduction in pain with these more coordinatively challenging exercises, because again, there's just more stimulation of neural circuitry compared to maybe a local loading strategy where you're loading the knee in isolation here. But that may be something that's necessary for function. And so it may be something that's, for example, with lower level tasks, just to try and kind of reduce that pain experience. A coordinative challenge can be helpful, but if you want to be more functional, meaning you want to get back to a task that involves a lot of load on the knee itself, you certainly want to allow the client to experience that local load, that concentrated load into the knee in isolation. Okay, so lots of ways that you can progress this as well. Of course, one of the ways that you can progress this from a local standpoint is just by simply moving things dynamically, by actually getting more lengthening and shortening through the tissue, which is going to create more metabolic demand. It's going to be a little bit more, it's going to challenge those tissues to handle more load through the range of motion, because of course you don't just want to load isometrically. You want to allow those tissues to experience load through a range as well, through more of an isotonic loading strategy. Okay, of course we've spoken about ways where clients can cheat with this as well. Clients may pull the toes back in order to get more knee flexion. But if you were to relax the foot, it's going to open the back of the knee a little bit. You still want to try and maintain that perpendicular position of the femur, the parallel position of the shin as best you can. Clients will typically note that allows for a greater experience of load through the hamstrings. You can, of course, take away the position of the hands. And then, of course, there's other machine-based activities. There's other ways that we can set up the body to get more concentrated load into the lower hamstrings. With a strategy like this, you may, in terms of what your endpoint goal is, if the endpoint goal is to allow for the hamstrings to tolerate more load, then I wouldn't necessarily... You could progress this, but then you have to be considerate of, okay, how do I want to load the hamstrings? How do I want to challenge the hamstrings? If I want to challenge the upper hamstrings, the hip extension component, then I would probably just move my body back further. If I wanted to challenge the lower hamstrings, then I wouldn't really use this as a component or as an exercise strategy to manipulate in order to get that challenge. I would progress to something like this, and that's why we have that as week 3. Because again, I just think it's an important quality to be able to tolerate load into a local area, into a local joint, because the knee is just one of those areas where I think it's more susceptible to compensatory loading strategies above and below. The hips will often try to contribute, the ankle and foot will often try to contribute, the spine will often try to contribute as well. But hopefully that gives you a little bit of an understanding of why the position of the foot relative to the hip is very important here. They're at the same level. Here are the foot's above the level of the hips, even with something like changing the behavior around the lumbar spine. Let's say you wanted to load the hamstrings while facilitating a posterior pelvic tilt or rotation. You may use a strategy like this because the femur is already, the hip is more flexed via the femur, meaning it's more posteriorly rotated relative to this position, and so that's going to aid the ability of the pelvis to posteriorly rotate. And so we can simultaneously allow the client to experience that posterior rotation, hold that position as we shift and steer that load into the hamstrings. Now you would first of course have to understand, well, do the hamstrings actually need that load, or are you just using it as a way to challenge the position of the pelvis? Maybe you may have chosen an abdominal loading strategy, maybe just more of a passive mobility strategy early on. But relative to this one here, where the hips are beginning to extend via the femur, this would be more of a challenge in that scenario now, because the movement of the femurs in this direction here, which will be a forward rotation, would be trying to pull the pelvis into a forward rotation with it, meaning that would challenge your ability to maintain that posterior pelvic rotation. So understanding the kinematics, the segmental interactions there, combined with the kinetics, and I remember I spoke about something there briefly about that just reminded me. If you really wanted to reduce or increase contribution from the knee flexors, instead of driving straight down, you would drive down and slide back, because then that would really reduce any kind of contribution from the hip extensors. That would put a much stronger knee flexion demand on the hamstrings, the lower hamstrings. But again, I would just urge you to be cautious with these strategies. It looks easier, it's a shorter lever, but again, it's constraining the demand into the knee itself and not giving any other tissues the ability to handle that load. And I've had clients, post, not necessarily, post ACL reconstruction, but even kind of months and even years after this, use the strategy here and their knee blows up after a couple of sets of trying to push for 45 to 60 seconds, because again, they may not have had that opportunity to really experience that isolated load. This is secondary or after really bad rehab plans. Of course, if you're a good practitioner, you will be exposing the knee to load in isolation. But these are the plans where they're doing very basic quad exercises, very basic hip exercises, and maybe not even looking at the hamstrings. But then you have to be more mindful about how you reintroduce load into the system, and then that's one of the biggest reasons why we kind of use a coordinative or global understanding versus a local understanding. But it can be applied to isometric strategies. You just have to have a good solid understanding as to how forces will impact the system, how the kinematics and the organization of segments will influence how the system experiences those forces. You cannot use this approach if you don't have a basic understanding of biomechanics. It's a prerequisite to it. Because there are opportunities to shift load into other areas. So you're trying to reduce that from happening. Okay, so hopefully that made sense. Hopefully it kind of gave you a little insight into how you can tweak things in your own programs. And like always, if you have any further questions, please let me know.